if someone's plan is leaving the market, they will have gotten a letter from their plan saying that your plan won't be available next year and giving some options. One of those options is they can either pick a new Medicare Advantage plan or they can go to a Medicare Supplement or Medigap plan without any health questions. But the important part is that they do nothing at all. In January, they're back on original Medicare, but the problem with that is they would pay an unlimited max out of pocket. There's no cap on original Medicare. Also, they would have no prescription drug plan in January.
All right, so the first time Medicare is capping the amount of money that older Americans pay for their prescription medications. Would you explain, first of all, this change?
Yeah, so before there was no max in the pocket. If somebody was on a very expensive medication, they could spend $10,000, $15,000, $20,000. It's very rare, but it could happen. So for the first time ever next year, we're going to have a $2,000 max amount of pocket. So that means if someone's on some very expensive medications, the most they can spend for the entire year is $2,000.
So that would be a good thing, I would think, for particularly cancer patients, people who are really sick and take medicine where there's no generic, version available and it's very expensive, like we've heard with Eliquis as an example.
Definitely. So cancer medicines make a huge difference. People take cancer meds, they'll hit their $2,000 usually in January. It is affecting the name brands, Eliquis, Prodaxa, some inhalers. There's a lot of those medications that are just very, very expensive that people will hit their max out of pocket. We're seeing a lot of folks will hit it kind of mid-year, but yeah.
Okay, so that's good for them.
Yes.
Is this good for everyone else, though?
It sort of depends. So there are now two variations of Medicare drug plans. There's the defined standard and there's the enhanced. So the downside is the donut hole is going away. That's actually a good thing, the donut hole is going away. But in the donut hole, people pay 25% of the cost of medication. So now the defined, like the minimum basic standard is a drug cost is 25%. So if somebody gets a new drug mid-year, they'll hit that 25% right away. And just overall drug costs we're seeing going up across the board, whether it's a generic or a name brand.
Okay, so someone who doesn't take a lot of medications, older Americans, I mean, is this a good thing for them?
So again, sort of. Another thing we've seen is the drug plan premiums are going up. If someone's on a standalone Part D drug plan, we're just kind of seeing those costs go up.
Okay, so somebody who doesn't take really expensive medications should expect, though, that the cost of the plan is going to go up next year.
If they have a standalone Part D plan with a Medicare Supplement or Medigap, Medicare Advantage plans, those truly just vary from plan to plan.
So there's a lot there, right? And I think that the bottom line is that don't make assumptions when it comes to Medicare or any of the additional supplements or Advantage plans that you have. You really need to dig in, take a good look, because changes are happening next year.
Definitely.
So I want to, the new Medicare costs for next year have actually been released. You have a reference here.
Yes.
And the bad news is the costs are going up. It feels like everything these days goes up every year.
Right, they go up every year. They've got, from 1965 to today, the Part B premium started at $0. Now next year, Part B, that's what someone pays just to be on Medicare. It's going from $174.70 to $185. It's not a huge jump. So that's your cost just to be on Medicare. The Part B deductible, if someone has a Plan G or a Plan N on their supplemental plan, or they just have straight Medicare, that's going up from $240 to $257. Again, not big jumps. And then on those folks who have a higher income, it's called IRMA. If you have that, somebody knows exactly what that is. The income threshold for that is going from $103,000 for an individual, or $206,000 for a couple, to $106,000 and $212,000. Anything
about this surprise you at all, or anything that our viewers at home should say, hey, wait a minute, you need to take a closer look?
Not really. I mean, they're going up slightly. It's not big jumps. One thing on the IRMA, if someone has a higher income, a lot of times when people stop working, that income goes down. So if someone's gotten a letter saying they're going to pay a higher premium, there's a specific form they can fill out if their income is not what it was before.
Yeah, and that's important too also, because that could really save you a lot of money. Now, I just want to revisit, in case our viewers missed this last week, 15% of Medicare Advantage plans are exiting the market next year.
Yes.
Would you explain why that is obviously significant then to some of our viewers who might make an assumption that they don't need to do anything, but really need to take a closer look?
Yes, so if someone's plan is leaving the market, they will have gotten a letter from their plan saying that your plan won't be available next year and giving some options. One of those options is they can either pick a new Medicare Advantage plan or they can go to a Medicare Supplement or Medigap plan without any health questions. But the important part is that they do nothing at all. In January, they're back on original Medicare, But the problem with that is they would pay an unlimited max out of pocket. There's no cap on original Medicare. Also, they would have no prescription drug plan in Jerry.
Okay, so what do they need to do?
They need to pick something for next year. If you can afford a Medicare Supplement or Medigap plan, you get one with no questions asked. If you can't, or you want to stick with your HMR PPO you've had over the years, we can help them shop for a plan for that for next year as well.
So I think that the people who are turning 65 next year, this can just be dizzying.
Yeah.
It can really be overwhelming.
Yeah.
Can you just briefly, you've got Medicare, which you can automatically enroll in if you've been, taking Social Security. If not, deductions, then if not, then you need to make sure that you enroll in Medicare next year. But also, there's Advantage plans, there's supplemental plans. Can you explain the difference between an Advantage plan and a supplemental plan?
Yes. So before that, someone wants, I actually wrote a book on Medicare. Go to MedicareAlphabetSoup.com. They can request a book, we'll send it to them. But really, the most basic version is Medicare Supplement. You're paying for freedom and choice. Almost any doctor, anywhere, anytime, no questions asked. A Medicare Advantage plan is very much like your group health insurance. You might have referrals in HMO, you've got prior authorizations, but from a copay out-of-pocket standpoint, they beat the pants off of almost any group plan.
The Advantage plans do.
Yeah.
But do you get as much coverage?
We find a lot of times people get more coverage on Medicare Advantage plan than they would on their group plan, but it really comes down to whether someone wants to pay for that freedom of choice or stick to a network.
Bill, thank you.
Absolutely.
This
Thank
has
you.
been great education, certainly for me, as I'm, navigating this with older parents and relatives.
Yeah.
I really appreciate it. And I know our viewers, given the fact that 65 million Americans are on Medicare, this is certainly an important topic for them. We appreciate your time.
Thank you.